Hello, my name is Colette Brooks and this is my Unit 19 presentation on human immunity, covering various aspects of immunity within humans. The human body has three lines of defence, of which two are non-specific and present from birth. The first line creates physical and chemical barriers preventing pathogens entering the body. The second line is a natural response taking place when the first line of defence fails. Two examples are inflammation, increased white blood cells, and fever, increased core body temperature. The skin has three layers that separate the body from outside environments. Intact skin acts as a barrier to prevent pathogens and infectious agents entering the body. The epidermis provides a waterproof layer allowing sweat and subcutaneous glands to release secretions along the surface, providing nourishment from oils and temperature regulation. The Malpighian layer in the epidermis produces melanocytes, creating melanin. The more melanin a human body has, the darker the skin tone. Melanin is a UV absorbing agent that protects the skin from the effects of UV and UVB rays on the skin surface. The mucous membrane is a layer of cells made from ectodermal tissues that contain and secrete mucus around the organs. Microorganisms reside in the secretions, enabling them to form a defense barrier, preventing infectious agents, pathogens, and allergens invading the body. When the integrity of the mucous membrane is compromised, it leads to an array of infections and diseases entering the body. Vaginal mucus secretes a fluid in the vagina, keeping it moist, preventing colonization of bacteria. If pH levels in the vagina become imbalanced, fungus and bacteria begin multiplying, initiating an infection. The endometrium is a mucous layer lining the uterus, enabling the growth and protection of an embryo at a blastocyst stage. If fertilization does not occur, the lining is shed during the menstrual cycle. Pathogens can enter the body via the nasal cavity. Ciliary that lines the walls and airways along the nerves is coated in a liquid layer of mucus that prevents foreign bodies entering the body. The mucus layer traps pathogens. When blowing the nose and coughing, it dislodges the microorganisms from the mucus lining, forcing the ciliary to move rhythmically up away from the lungs, causing pathogens to exit the body. The urinary tract is a system that has many barriers to prevent the risk of infection, varying in between males and females. The urethra in males is long enough that it rarely allows bacteria to enter the bladder, as urine frequently exits the body, washing away pathogens. Medical devices such as a catheter can introduce bacteria and other pathogens into the body, encouraging the development of encrustations that block the catheter. Women are susceptible to bacteria to pass into the bladder as the urethra is shorter. When the bladder empties, it flushes the pathogens away, out of the system. Progesterone is a hormone present in pregnancy that causes various tissues to relax, making it easier for pathogens to enter the bladder, causing urinary tract infections. An inflammatory response is triggered when a foreign substance or pathogen obtains access into the body, creating an increase in blood flow. Blood vessels expand, increasing the volume of blood, along with the release of histamine from mast cells, creates a site of inflammation, causing pain, heat, redness, and swelling. White blood cells surround the foreign body. Gaps are created, allowing blood cells to pass through, whilst complement proteins break down and remove pathogens, allowing cytokines to prevent the reproduction of a virus. An increase in core body temperature indicates the immune system is reacting to a cardinal response to infection. The rise in temperature triggers cellular mechanisms to move quicker for them to act against the virus or bacteria. To create fever, the immune system produces pyrogens, convincing the hypothalamus that the body is cold. The hypothalamus initiates a response to increase core body temperature. The rise in core body temperature kills pathogens, as the body will no longer be able to provide optimal conditions. Macrophages are large phagocytic white blood cells originating from monocytes. They become specialized cells after the monocyte leaves the bloodstream, penetrating infected tissues and undergoing a series of changes to become a macrophage cell. As a phagocyte cell, they recognize, engulf, and destroy pathogens created by infected, dead, or damaged cells. Macrophages have specific names depending on where they are located and how they function in the body. Macrophages present in the brain are known as microglia. These protect the central nervous system from foreign elements. Pathogens are microorganisms that cause infection or disease, whereas antigens are part of a pathogen that notifies the body when it's attacked, creating an immune response by arousing the body's illness-fighting white blood cells, called lymphocytes. Immunity in the human body develops over time. It is known as acquired immunity, caused by exposure to the natural environment. The immune system learns, adapts, and remembers previous antigens, enabling the immune system to tailor its attack. Acquired immunity is achieved both artificially and naturally through active and passive mechanisms. Artificially acquired immunity can begin actively by exposing the body to foreign antigens Unlike naturally acquired immunity that is naturally exposed to an infectious pathogen, artificial passive immunity is produced by introducing preformed antibodies generating a protective immune activity, which differs from naturally acquired immunity, being the transfer of antibodies from a mother to a fetus via the placenta. Protective immune defences can be responsible for unwanted responses known as hypersensitivity reactions, which are classified by 4 immune mechanisms. Type 1 triggers mast cell degranulation involving immunoglobulin E antibody against soluble antigens. Type 2 involve immunoglobulin G and M antibodies being directed against cellular antigens, causing cell damage facilitated by other immune system effectors. Type 3 interactions between immunoglobulin G and M, and occasionally immunoglobulin A, antibodies with antigen to form immune complexes. The buildup of immune complexes within tissues causes damage mediated by other immune system effectors. And lastly, type 4 reactions are T cell mediated that involve tissue damage caused by activated macrophages and cytotoxic T cells. Leukocytes are several cells in the immune system that protect the human body from infectious diseases. There are 5 different types of leukocytes produced and derived from the component cells in the bone marrow. Neutrophils are white blood cells that combat pus-forming bacteria. As a chemical attack say, they are the first cell present at the site of an infection. They move through the blood vessels where they are able to overcome invading organisms by phagocytosis and attract more immune-combating cells to the site by releasing cytokines. Lymphocytes are present in lymphatic tissues where they are responsible for antibody production. There are 2 different types of lymphocytes. B lymphocytes produce antibodies while creating a memory of infectious pathogens that have entered the body. T lymphocytes are important for cell-mediated immunity. There are 3 different types. Cytotoxic T cells create perforin and perforate infected cells by attaching to pathogen cells, releases performin directly into the cell, which causes the cell to self-destruct. Suppressor T cells suppress the function of helper cells and cytotoxic T cells, stopping excessive damage to tissues within the body, preventing autoimmune attacks. And helper cells regulate immune functions in the body by releasing lymphokines. Monocytes, as previously mentioned, develop into macrophages. Monocytes recognize, engulf, and destroy pathogens created by infection, dead or damaged cells. Endophils work by releasing toxins from their granules to kill pathogens, as well as accumulating at the site of an allergic reaction. Increased levels of endophilias are responsible for endophiliac diseases such as asthma. And basophils trigger inflammatory reactions when the body is invaded by foreign bodies, releasing histamine and heparin. Histamine causes blood vessels to widen, allowing more space for immune cells to fight against injury or infection, whereas heparin is an anticoagulant that prevents blood clots forming at the site of an infection or injury. Immunoglobulins are known as antibodies that neutralize pathogens. There are 5 different types of immunoglobulins. Immunoglobulin G attacks anything that it recognizes as a foreign body, found throughout the body, and is the only antibody that travels along the placenta, providing a fetus with immunity to diseases. Immunoglobulin A defends soft muscular surfaces surrounding the mucous membranes. Immunoglobulin M differs in structure from the immunoglobulins and is the first antibody to respond to antigens. Immunoglobulin E, which there are low levels in a body, but they do increase significantly responding to parasitic infections and allergic reactions. And lastly, immunoglobulin D acts as an antigen receptor on the surface of B cells in the bloodstream. Self-recognition in the immune system relies on the body reorganizing, detecting cell-produced chemicals, cells and tissues, enabling the body to attack foreign objects. Histocompatible complexes 1 and 2 are 2 factors that enable the immune system to identify between itself and non-self, along with the human electrolyte antigen gene complexes. MHC1 is an early warning system that is expressed on virtually all somatic cells. MCH1 molecules degrade foreign bodies. They then display the fragments on the surface of the cell, allowing T cells to remove the fragments. MCH2 are present in certain nucleated cells. They present antigens from extracellular pathogens, initiating an immune response. T cells clean antigen fragments on the surface of an immune cell, and fragments are created when pathogens are endoscopized by B cells. Phagocytes are digested using lymphosomes. The human immune system is complex. Sensitivity to antigens differs in every system. Hypersensitivity is an abnormal immune reaction that causes immune responses having repeated exposure to the same antigen. Self-tolerance prevents an immune response against antigens where the immune system recognizes self-produced antigens as a non-threat. Different cell types are constantly produced and respond appropriately to foreign antigens, destroying self-reacting lymphocytes, and if this fails, B or T cells are then activated. Antibodies react against self-antigens, creating the basis of autoimmune diseases. There are 4 categories hypersensitive diseases are grouped into: immediate hypersensitivity, antibody-mediated hypersensitivity, immune complex mediated, and cell-mediated hypersensitivity. Transferring and replacing cells, tissues, or organs from one body to another, the immune system has developed a durable barrier, creating an effective and elaborate mechanism preventing foreign entities entering the body. Transplanted organs may be rejected by a recipient's immune system due to being considered foreign, as the antigens on the received organ are different from the recipient's. Rejection happens when antigens between a donor and recipient are not matched close enough. Monoclonal antibodies are used during and after surgery as they eradicate T cells, which stimulate an immune response to destroy the transplanted tissue, causing the organ to be rejected. The 3 different types of rejection. Hyperacute rejection occurs almost immediately post-transplantation, where antigens are unmatched. To prevent death, the tissues need to be removed immediately. This reaction is often caused if a person is given incorrect blood types. Acute rejection usually occurs within the first year of transplant, causing an organ to slowly lose the ability to function, which then leads to chronic rejection. Chronic rejection is the constant attack from the immune system causes damages to a transplanted organ, causing long-term loss of function in the transplanted tissues by fibrosis. Autoimmune diseases develop when the immune system attacks healthy cells, mistaking it for foreign or damaged tissue within the human body. Autoimmune diseases have flare-ups, where symptoms worsen, and remission, where the symptoms are virtually eradicated. 2 immune disorders are rheumatoid arthritis and multiple sclerosis. Rheumatoid arthritis is a long-term condition that causes pain, swelling, and stiffness in the joints. As a chronic inflammatory disorder, it starts gradually causing inflammation in the joint capsule, affecting the nerves, causing chronic pain in the joint. Rheumatoid arthritis is a progressive deteriorating autoimmune disease. This picture demonstrates the difference between a healthy knee joint compared to one with rheumatoid arthritis. There is inflammation all around the knee, causing pain, stiffness, and an inability to function properly due to an erosion of the bone and lack of cartilage. Multiple sclerosis is an autoimmune disease where the immune system attacks myelin, the protective layer coating the nerve fibers in the central nervous system, causing inflammation and lesions. Nerves are located throughout the human body, causing more than one specific site of attack. The symptoms, unlike other autoimmune diseases, that attack a particular area. Symptoms of MS include numbness and loss of function in limbs, fatigue, and slurred speech. There are 3 main types of MS, each having various degrees of flare-ups and periods of remission. Autoimmune diseases are hard to diagnose due to the symptoms presenting as other conditions, as well as some autoimmune diseases having the same symptoms as another. To achieve a definitive diagnosis, investigations are required to determine where the immune system is attacking the body. There is limited information on how autoimmune diseases occur and how to stop the attacks, although it is thought that eating a well-balanced diet, having exercise, and getting plenty of rest can alleviate the symptoms. Active and passive are 2 types of adaptive immunity, both having a natural and artificial response. Active natural immunity occurs when the human body is exposed to live pathogens, creating a specific disease that the body forms immunity towards. Chickenpox is a virus often caught during childhood. When that virus enters the body, an immune response is triggered, where T cells attach and deliver them to B cells. Antibodies are then created, neutralizing the virus, and B cells remember that virus, providing long-term immunity. Active artificially induced immunity requires the human body being artificially and intentionally exposed to a foreign antigen. Through exposing that body to a foreign antigen, it produces antibodies and B cells with high affinity B cell receptors on their surfaces. If the body then becomes exposed to an antigen, it can respond immediately, producing an appropriate antibody for that protection. Recently, the COVID-19 vaccinations have provided induced immunity, enabling an adaptive response to fight that virus. Natural passive immunity occurs when antibodies are transferred during pregnancy and are transported through the maternal blood into the fetal bloodstream via immunoglobulin G, providing initial protection. Artificial passive immunity provides protection against pathogens. Immunity is provided by vaccinations or blood and plasma transfusions, where antibodies neutralize pathogens in their new location. As the antibodies have been artificially induced, they break down and are not naturally replaced, as they cannot be created by the receiver's own immune system. Vaccines contain various versions of pathogen-stimulating white blood cells, enabling antibodies to combat pathogens. Immunological memory is created through previous exposure to pathogens. When a pathogen invades the human body for the first time, B lymphocytes and plasma cells create antibodies. Due to the time this takes, the body responds to the symptoms. If the same pathogen was to enter the body again, B cells remember that invader, allowing antibodies to respond immediately. Live vaccinations allow the body to create memory cells, providing long-term protection. However, inactivated vaccines act slightly different as they are artificially produced. They are unable to replicate, meaning multiple doses need to be administered to create that memory. Herd immunity occurs when a large percentage of a population becomes immune to specific diseases or viruses, offering protection to those that are vulnerable as the disease struggles to spread, causing it to disappear. Herd immunity can be achieved via vaccine immunity or natural infection. Vaccine immunity provides a large population with a vaccination containing a weakened form of the disease, whilst natural immunity occurs when the body makes antibodies and B cells after becoming infected with a pathogen. The World Health Organization makes decisions regarding diseases after extensive research and provides information that determines if a vaccination program is beneficial for the population to create herd immunity. When vaccination programs are introduced to communities, providing protection from a disease-causing pathogen, the transmission of pathogen rapidly declines. Herd immunity is more complicated than passing infectious pathogens from one person to another, creating several barriers. The WHO acknowledges that every disease is different. The required percentage of a vaccinated population varies depending on how contagious the disease is. Measles required 95% of the population to be vaccinated, whereas polio, only 80 to 85% needed to be vaccinated. Herd immunity may be delayed due to a vaccine hesitancy, preventing vaccines being administered due to the concerns over safety, religious beliefs, and misinformation. During the COVID-19 pandemic, there was a lot of hesitancy caused by distrust towards the vaccination, whether it was safe. The long-term side effects were unknown, and the media portrayed that there was a lot of concern on fertility. Many people did not know what to do for the best, believed it was unnecessary for those that were low risk of harm from the virus, which created distrust in the government. There is no doubt that vaccines have saved lives, eradicated diseases such as smallpox that resulted in 30% of deaths from those who contracted it. The WHO declared that the last known case of smallpox was in 1971. Other diseases like rabies have virtually been eradicated in the UK. The last known cause was in 1902. Rabies is a disease that affects mammals, making it a little more complicated to eradicate worldwide, as all mammals would need to be immunised. A small number of bats are infected with a type of rabies in the UK. The Department of Environment, Food and Rural Affairs requires those that are in contact with bats must have a licence to maintain safety. All other mammals entering the UK must be vaccinated against rabies, preventing an outbreak. The introduction of childhood immunisations has seen childhood mortality rates reduce significantly. The MMR vaccine protects children against measles, mumps and rubella. As a live vaccine, the body develops adequate immune responses, causing a few symptoms of the disease, but as the doses are minimal, antibodies can fight the infections, whilst B cells create a memory of the infection, providing lifelong immunity. Vaccination programs not only help prevent disease, but they are cost beneficial for the NHS. The cost of treatment is far greater than the cost of a vaccination. For example, the HPV vaccine is offered to children in Year 8 at school, providing protection against cancers caused by the HPV virus. Each vaccine costs £170, considerably less than the nearly £20,000, which is the average cost of the NHS person diagnosed with a stage 2 or later cervical cancer. Whilst vaccination programs do not protect against exposure to what is being vaccinated against, researchers found that should a person contract the disease and develop symptoms of an infectious pathogen, they are more likely inclined to have milder reactions, which are less likely to cause serious harm or death, as antibodies and B cells are able to combat pathogens effectively. Thank you for listening to my presentation. Is there any questions you have regarding human immunity?